Well, this could be one of the biggest bombshell civil pieces of litigation. And what does Bill Gates, Albert Bourla, Mark Rutte all have in common? Well, civil litigation related to COVID in the Netherlands. And what does this case mean moving forward to try to get answers for the rest of the world? And all of this is tied to maybe the COVID emergency measures, which did not begin in 2020 at all, but were actually put in place years earlier inside of a Pentagon-backed pandemic program that was built for speed. Like, we got to get this thing rolled out here. It all appeared to the world as if this thing came out of nowhere, but it didn't. And that's the explosive question being raised by newly published material from Sasha Latypova, who centered on leaked internal AstraZeneca audio that she says points back to a Pentagon-planned, DARPA-linked pandemic program dating back to the year 2017. In other words, major players inside the government, big pharma, were already treating it as a national security operation years before most Americans or people living around the world even understood what was happening. Sasha Latypova worked at the highest levels of big pharma as a medical device R&D executive, and now she spends her time exposing fraud and lies inside the pharmaceutical industry as a journalist and researcher. And Sasha joins us now. Great to have you back on the show. It's been a number of years, but thank you for your latest work on this. Great to see you.
Hi, Clayton. Thank you for inviting me again. And yes, great to see you again. Thank you.
Thank you. So let's start with the Netherlands. Albert Bourla, Bill Gates, Mark Rutte. Of course, I love how people like Mark Rutte who fail in life get promoted to the head of NATO. That's how these things work, right? So what do the three of them have in common, and why are they being forced to appear before a court in Amsterdam related to COVID? Can you walk us through this?
Right. So they are all defendants in the civil litigation procedure that started around 2023. And there are two cases. An older case was filed in 2023. These individuals, including several other high-level Dutch state officials who all participated in Project COVID, are named as defendants, as individuals. And that's a unique feature of Dutch law, where individuals can be brought like this into the civil tort litigation. And so they are all, they tried to get out of this case. Bill Gates tried to claim that, he is not subject to this jurisdiction, but the judge actually ruled that Bill Gates and Albert Bourla as individuals must respond to this case. They haven't appeared individually in court, but their lawyers are present and their lawyers are responding on their behalf, so they're part of the defendant group in this litigation. So on March 9th, yes, so we were in Amsterdam at the Court of Appeals. I was there in person. So was another expert witness, Joe Sansone, and also about 60 journalists, podcasters, and members of the public and plaintiffs showed up with us in the Court of Appeals. And in fact, there were so many people on the plaintiff's side that the court had to give us 2 rooms because one wasn't big enough. And so that proceeding was very explosive. There's a video of it. We've subtitled it, translated it. I made all the materials available, where Peter Stassen, who is the only attorney prosecuting this case now, his co-counsel was imprisoned and disbarred. So now we're down to one attorney on a shoestring budget. So he made an amazing speech. It went viral for a few days on Twitter. And so it's available on YouTube. And he laid out the case. He laid out that these people all conspired to create Project COVID, to create this pandemic preparedness racket years ahead of 2020. And Bill Gates is a key participant in it. They were all profiteers trying to set up this fake pandemic and very real response by the governments, which they pulled off, and then profiteer off of it massively, which they did. And so the plaintiffs are injured individuals by Pfizer vaccine, and they're seeking justice and compensation for their injuries. So that's kind of in a nutshell. We're expecting the Court of Appeals decision on April 9th, but we also have now scheduled a court hearing on substantive matter finally on October 22nd in lower court in the Netherlands in Leeuwarden. And I'm going to be there in person again, and we're going to have a public event there again.
So, can you talk about how Bill Gates and Pfizer, Albert Bourla, conspired? Because that's the argument from the prosecution and from the plaintiffs that Bill Gates, Albert Bourla, Mark Rutte, they got together and conspired to create what they're calling Project COVID. Maybe you can walk us through the machinery of that.
Right, exactly. So I had a lot of, I would say, indirect but very well documented evidence that private NGOs like Bill Gates, the military, NATO, and DoD, obviously this was all centered around DoD massively, DARPA, which is DoD's Advanced Research Project Agency, pharmaceutical companies who were part of this consortium were approached by DARPA in beginning as early as 2012, but I have very, very direct evidence, as you mentioned, the tape from AstraZeneca, that in 2017, DARPA specifically approached AstraZeneca and said that to these key executives and said that, oh, we can fund this project where, and you can be part of this consortium. A consortium is already a conspiracy, essentially. So you can be part of this consortium where we, the DoD, the military, identify pandemic potential viruses, not very clear how, and you, the pharma, will be making vaccines and therapeutics within 60 days of that. To which the response, and I have it on tape from key executive of AstraZeneca, was, I thought it was science fiction. And that's the truth. So he is admitting that he knew at the time this was fake and they were fraudulently being induced into this activity. But of course, this is the US government, the DoD, telling them that and waving a lot of dollars. So of course they said yes. And of course, another 300 companies in this consortium said yes. And they all got together and they started working on these projects where DoD was funding these, science exercise, no deliverables, lots of money, what's not to like. So they've been doing this for a few years prior to 2020. And in 2020, DoD made a phone call on February 4th to AstraZeneca and other participants of consortium, telling them that COVID is declared national security threat. Again, not clear why. We still don't know why. That hasn't been classified. Nobody has any evidence of how that decision was made, who decided, based on what data. And they just all went live exercise, and all over the world in synchronicity, in perfect synchronicity. So while I thought that, I do have this evidence, but it's very, it's hard to prove that, Bill Gates specifically was, very, very key to this. Now, and I never expected Bill Gates would put this in writing that I would like to do this project COVID, but he did in the emails with Epstein. So when the emails with Epstein files were released, it's evident that Bill Gates, Epstein, and JP Morgan, the bank, were setting up a financial structure to do exactly this, to prepare for pandemics and profit of it, and also utilize Bill Gates's, or not trigger the for-profit status of this activity by utilizing the charitable structures and how to avoid taxation and all that. So they were not only structuring pandemic project, they were also figuring out how to avoid taxes and how to profit of it massively.
And this was really at the request of the DoD, the Pentagon.
Yes.
They were specifically asking to create this. Did they call it Project COVID? What kind of military? They love to give military names and operations. What was the name?
So the name was a pandemic preparedness, so PPP, pandemic preparedness program, something like that. It was loosely called that. There were also other names given to other activities like, countermeasures. At some point within the Epstein exchange with Bill Gates, there are names like Project Molecule being thrown around. So they do give them different names. But overall, it's a public-private partnership, which is, again, a conspiracy between corporations, banks, pharmaceutical companies, government, military. It's public-private partnership. to create these pandemic preparedness planning activities, military countermeasures activities all over the world. And also there's extensive documentation evidence and evidence in law how all of this was over these decades synchronized across the world, especially key military allies like NATO, the Five Eyes security allies, Australia, New Zealand, Canada. They all have the same analogous law to the US law that enables all this activity and makes it all legal.
Well, it's no secret Americans love sushi, my daughters included. And over the last 2 decades, raw fish consumption has exploded. Sushi bars everywhere, grocery stores selling it, gas stations sell it. Millions of people now eat raw fish weekly, but here's a hidden risk most people never think about. Parasites. Yeah, salmon, one of the most popular fish worldwide, but it naturally contains more than 70 parasites. Most of them are tiny, nearly impossible to see them. I'm sure you've seen the videos where people have gone to like Costco and they come home and they let their salmon sit out on the counter for a few hours and suddenly the little white parasites start popping out of the fish. Ugh. But once inside the body, parasites can hide for years while frequently laying eggs before any symptoms appear at all in the body. That's why many physicians are raising awareness about parasite exposure. Our friend of the show, Dr. Peter McCullough, recommends doing a parasite cleanse at least once a year as a preventative measure. The Wellness Company offers a hard-to-access RX parasite cleanse, USA compound with ivermectin and menbenzidol. Now, ivermectin paralyzes the parasite's nervous system, and then menbenzidol starves them. Each capsule contains 25 milligrams of ivermectin, 250 milligrams of menbenzidol, lab tested for quality. You can now get a more budget-friendly 45 capsule option that costs $250 less, giving you 2 21-day parasite cleanse cycles. It's the same formula as the original, just a smaller quantity. So head right now to twc.health/redacted and use that code redacted to save $35 off plus free shipping. And so I guess I'm looking for the motive here, right? Mm-hmm. Is it purely money or was it control? I mean, the way I see it now is it's all about control. It was them telling us, cash has COVID on it. You can't touch paper money, the lockdowns, control, all of it. So was it in these documents, in this research, did you find the clear motive from the DOD and Pentagon?
So they never, they don't state the clear motive, but this is a very long running history. So it actually goes back about 100 years at least. But people need to understand that public health and especially mass vaccination programs are part of long-running eugenics agenda, and they have always been a military activity. So the U.S. before mass vaccination programs, before they put on the books in the 80s the National Vaccine Injury Law, these activities from early 1900s and especially during the Second World War and immediately after the Second World War, when the U.S. had official bioweapons development program, it was covert, but it was legal, ran until Nixon stopped it in '69. So during that time, especially, all vaccines were military owned and developed and co-developed. Always. There's always military involvement in development of all vaccines, the polio vaccines, everything else that was developed at the time. All science and all pharmaceutical development is tightly linked with military. So they already had the public health, military, public-private partnership. In fact, there was official pharmaceutical bioweapons consortium at the time. It was headed by George Merck, Merck Pharmaceuticals. He was the civilian head of the US bioweapons development program. And their main activity was making vaccines. And there's even Merck report declassified describing this. And also about 80 academic institutions were at the time participating in the same program. So this is a very, very long-standing activity that simply evolved. And the key evolution is not what they were doing on the medical or vaccine making side, but what they were doing on the legislative side to remove liability. Because every time they would try to push their products into the public, there would be a lot of injuries and deaths, and there would be a huge scandal. And they would have to cover up the scandal and pay the liabilities and so forth. And that evolved into the PrEP Act. So the PrEP Act is the final, I would say, final activity that you can say here's a very, very clear evidence of intent of them doing this, and importantly, getting away with this without any justice, accountability, or liability. And people are saying, well, how can you say that? But lawmaking is highly intentional set of activities. So you can't say they didn't have intent. Somehow accidentally this law appeared on the books. And in fact, there is a congressional debate when the PrEP Act was being introduced in 2005, where Hillary Clinton and Joe Biden both stood up in Congress and said this law is hugely unconstitutional. It should not be passed because it violates several amendments of the Constitution, specifically people's right to sue in court and seek compensation for injuries and deaths caused by government activities. So how can you say that they didn't know, it wasn't intentional, that there was nobody brought up any objections to it? And the Republicans in Congress at the time pushed it through. So now we have this monstrous PrEP Act law that says that the government can declare a pandemic unilaterally. HHS Secretary RFK Jr. today, it's in his opinion that we have a COVID pandemic, that it will last until end of 2029 at least, so a decade of emergency, military emergency. And once that declaration is out and HHS Secretary signs off on it, then all these products, the COVID countermeasures, can be shipped completely without any regulation, not following any good manufacturing practices, not following any safety efficacy assessments. FDA cannot even issue legally safe and efficacious labeling for these products. So all these announcements, just marketing slogans. And there's absolutely no liability whatsoever for any injuries or deaths caused by the countermeasures under this declaration. So that's what we have right now. And that the law itself is the evidence of a massive conspiracy between the private sector and the government to do this, to hurt, to injure the population, and to cause all this damage that they have caused.
When in this court hearing, and I guess we'll have to unpack like what was actually said, what evidence was presented that showed that the defendants, Bill Gates, Albert Bourla, Mark Rutte, knew that these vaccinations were not real, and if anything, they were causing pain, they were causing enormous problems, massive side effects, etc.
Right. So to date, so we have 5 expert witnesses to provide evidence that would support these statements, and I'm one of the expert witnesses. 2 of us, so myself and Catherine Watt, who's doing the law research. We already submitted our written testimonies as part of the court documents, as part of the appeal procedure. And my own testimony contains a lot of evidence of, yes, the foreknowledge. And so the government officials and Albert Bourla and Bill Gates, so people who are the defendants, they are under the status of they knew or should have known. So these are the things that the government officials in health, so for example, when the health regulators in the Netherlands taking these shots and telling to the public in public advertisements, TV, media, that these are safe and effective, these are life-saving vaccines, you must take them, they will prevent transmission, and we will stop the pandemic and all that. These statements cannot be just made, because they can't lie.
Right. Like what is it? What is that based in?
Right. So it needs to be based on a legal standard for safety and efficacy. And the legal standard for safety and efficacy exists both in Europe under EMA standards and European Medicines Agency, and which is equivalent to the US FDA. Because they are now synchronized, they're all harmonized, the US and European regulators and Canadians and Japanese and all the Western world, they've all synchronized themselves through international conference on harmonization. So the regulatory frameworks are largely the same. They also have mutual recognition agreements. So now they can take statements from the FDA as if it's EMA issued those statements because they believe they're both equivalent. And then EMA can turn around and tell the public, yes, this is safe and effective. So my evidence that FDA through PrEP Act cannot even legally issue those statements, then EMA, with their high-powered attorneys and researchers and regulatory experts, thousands of staff, should have known this. If I, like average person working in the pharmaceutical industry, was able to find this information very easily, well, they should have known this. They should have known that FDA cannot say safe and effective, and they're issuing them under emergency use authorization framework, which is a countermeasures framework, which removes any regulatory requirements from pharma, removes informed consent, you can't even run a clinical trial on an EUA product. It's not possible legally to do. All of this is known. All of this is written into the law. And the European regulators know it very well. And the European health authorities, those individuals in charge, even if they didn't know, they should have known. They should have checked before they made those statements to the public. So again, because none of this happened, and it wasn't just like one instance or one example where they missed some information because they were in a hurry. No, we have a systematic evidence of all of them lying to the public in concert and denying all the injuries and deaths. So therefore, it's a very clear statement that they are actually guilty of conspiracy.
So they knew of the event, they knew of the adverse events, they were actively lying about it, and then you also believe then they were covering it up, right? Did you see evidence?
Of course, they to date they're all covering it up. In the U.S. they're covering it up, and in Europe they're covering. They're denying injuries. They're denying that these vaccines cause deaths and cancer and all those horrible things. And they're basically stonewalling. And they're not even responding on the substance. What was interesting in the appeal proceeding, we had one lawyer on the shoestring budget for the plaintiffs, 9 defense attorneys in the room on behalf of the defendants. And in this appeal, in the Court of Appeals of Amsterdam, it was expected, because again, this is a civil procedure, it's not a criminal procedure. It's expected that the defense will say something. So Peter Stassen talked for an hour about, presenting all this evidence. They sat there in the room. Their only response was, one of the attorneys spoke and said, COVID was a real illness and vaccines are safe and effective.
That's all they said.
That was it. Yeah.
When you talk about these defendants who brought this civil case, can you maybe walk through some of their injuries, what they experienced?
Well, so we have, in the earlier case, there were 7 injured plaintiffs. One person already died from their injuries. And they have a variety of injuries, from cardiovascular, the cardiac inflammation. People get autoimmune conditions. Some have cancer, I believe. And in the second case, we had 3 additional plaintiffs. 2 of them were in the room on March 9th, and one was too sick to attend. So all of these people are severely injured. They're unable to work. The government, in the Netherlands, maybe there's more social welfare type of deal, but still, people's lives are destroyed by these things, and the government continues to deny it. So that's monstrous.
And Bill Gates has really shifted his position on this, which seems to me problematic. When did he enough to make a lot of money off of it, and then shift your position later in interviews? Is that an important piece for this hearing, this trial?
Well, I mean, he shifts his position all the time,
right?
So yes, he's clearly getting in some sort of a pickle, especially after the Epstein files came out, clearly showing that he was conspiring and showing other kind of sordid stuff that he did with Epstein. Even I thought recently there was news that Warren Buffett is no longer investing into his charitable scams. And so that's a big ticket. It's something like $4 billion. So obviously Bill Gates is getting into some sort of a situation. And yeah, he will shift all the time, but he's always behind the vaccine push. Actually, in my recent article, I found that before even the COVID vaccines went on the market, these COVID countermeasures were pushed globally in December of 2020. In November of 2020, they very quietly pushed globally a new oral polio vaccine, which is known and very well documented in scientific literature that it's the only source of polio today. So they have reformulated the polio vaccine, including Bill Gates, Gavi, and other, usual players in this. They have reformulated it and pushed it under countermeasure under WHO countermeasure framework, which is called emergency use listing. And they pushed it globally into 40 countries of the world.
We have this immunity, as you talked about, here in the United States for these pharmaceutical companies going back to the 1980s, of course. There's been moves to try to get that removed in the U.S. I don't think there's any chance of it happening, but maybe that gives them protection, gives them immunity so that no one can really sue them for that. What laws are in place in the Netherlands where this case was brought that they're not offered that same protection, or are they?
Yeah, so in the US, we have the PrEP Act, which is the most monstrous piece of legislation. And I had several discussions with RFK Jr. about this, and he knows that he can just write a memo and remove that declaration, and this goes away. Liability goes away. But
by the way, he's talked about this. I mean, he's
talked about
before he ever became HHS. Yeah, exactly.
Before the HHS secretary, it was his, almost his campaign slogan. I mean, he was running on this agenda. After he became HHS secretary, he forgot that he can write a 2-sentence memo in the Federal Register. So anyhow, we have this PrEP Act monstrosity in the U.S. In other parts of the world, including Europe, they don't have that. But in Europe, they've made a synthetic version of it. I've written articles about exactly how they're doing it. So in Europe, they have a lot of the legislation around countermeasures, as I said, synchronized over time in preparation for this. And that legislation says if there is an emergency declaration, then the regulators can arbitrarily waive certain parts of compliance, good manufacturing practices, distribution practices, import-export laws, and they just decided to waive it all summarily. But then also through the contracts that Pfizer and Ursula von der Leyen, remember Albert Bourla and Ursula von der Leyen, by text messages negotiated for the entire EU, these contracts had clauses, and they were redacted for a very long time, and I think they're still not unredacted completely, but there were clauses that forced all the national governments to waive their liability laws for manufacturers. So that part about the liability that's in the PrEP Act automatically was just contractually forced onto the national governments in Europe. And that's why Albert Bourla is an important defendant, because we also have some emails showing that he was bullying the FDA, lying to them, lying to the EMA during the last phase of approvals. And of course, we know that he was negotiating with Ursula.
Right. And to provide enough vaccines, I think, was it 2 or 3 doses per EU resident? So the amount of money, the boondoggle, was substantial.
Yeah, and initially 2 to 3, but they actually ultimately went with 10 or something like that. Yeah.
So yeah, every EU citizen needs 10 of these, and that's how much money was changed. So this was all, of course, a massive money laundering operation. Can you walk us through February 4th, 2020? Because in the beginning, I talked about this 2017 timeline, right, where they were actively participating in this idea of emergency use authorization, this pandemic preparedness program. So February 4th, 2020, why is that date so important in your view? How do you connect the alleged Defense Department call to the government's declarations that were made effective on that very same day?
Mm-hmm. Yeah, so first, initially I didn't know about the importance of February 4th. I kind of flagged it in my mind because when the government first issued the declaration of emergency, it was issued, I believe, on March 13th, 2020, but it was made retroactive to February 4th. And so it was weird, why are you
Right.
making it retroactive? But then I received this tape from AstraZeneca. The tape is a Zoom meeting, internal Zoom meeting at AstraZeneca. I have the video portion. I just never released the video. It
I
doesn't
should
add
point
the
out,
whole
I'll
story.
link it up to your Substack page because you have it in the Substack article. And if people want to watch the video and you can listen to the audio of the AstraZeneca meeting, it's crazy. But go ahead.
Yeah, so the meeting was, so I have about 6 minutes clip of it. And the meeting was at the end of 2020 when they were celebrating approval of monoclonal antibody in the US. They didn't get the vaccine approved, but they got the monoclonal antibody approved. And that as part of the, them high-fiving each other, there's a discussion between their CEO, Pascal Seurat, and Mark Esser, VP of monoclonal antibodies. And he says, Mark Esser, he says, well, we received a phone call on February 4th from DARPA. And actually, the person who called, I believe, was Colonel Matt Hepburn. I've written about him extensively. He was very key player in the pandemic preparedness activities and all structuring this consortium. So Mark Esser says, DARPA called us, and it wasn't a surprise to us because we've already been in this consortium since 2017. But they called us and said that COVID was declared national security threat. So we also have emails, a massive email file. So with the list of email participants, like 2 to 3 pages long. So hundreds of people, internal government, military, HHS, CDC, all going out on February 4th, scheduling a conference, but the content of it is redacted. So we know there was a massive communication happening on February 4th because that's when DARPA decided to go ahead and engage the private sector in this activity to declare now we're going. This exercise is going, and with that declaration, they wanted to start the liability protection from that declaration because if they didn't, then pharma is exposed for a couple of weeks. All right, so when Trump was, it's not clear whether Trump was in on the deal from the beginning or he was somehow, managed to be brought on board. We know Tucker Carlson went to Mar-a-Lago around the same time in March and probably was key to convincing Trump to go ahead with this. So once they wrangled Trump to issue the declaration on March 13th, they said, well, we need to cover pharma because they've been already, DOD already told them go. We need to cover them for these few weeks. And so we will retroactively make it February 4th. So February 4th is a very, very key date. It needs to be investigated.
Yeah, no, that's a great point. And we hear about, I think, March 11th, March 13th, March 11th. We just did a deep dive on March 11th, and of course the announcement of the pandemic. I believe, I think it was 3/11, if I'm not mistaken.
Mm-hmm.
But also your story, we talked about this, but covers, starts in 2017. Matt Hepburn and DARPA's pandemic prevention platform. So what do you believe was actually being built under that program? Like, how far along was it before the public ever heard the word COVID? Because, what sort of scaffolding was being built as far back as 2017?
Yeah, so that whole activity was called pan-influenza. They gave kind of a pan-influenza name to it, and they said, well, generally speaking, we're going to be, dealing with respiratory pandemics. So they gave kind of a vague target to the pharma companies, and said we will be, and then started soliciting proposals for certain things like expansion of biomanufacturing facilities for a particular platform like this LNP and mRNA type of stuff. By the way, biomanufacturing is highly specialized and it's very difficult. I used to do modeling, financial modeling for pharma companies in this sector. Like, how do you decide to invest in the biomanufacturing while you're still in clinical trials? It's very, very difficult because the investments are huge. You have to commit way before you know that you have a product and you don't have safety problems. So this is very complicated. You can't just say, oh, it's totally fine. We can scale the manufacturing before we even complete clinical trials. This is nonsense, but this is clearly written into DARPA and BARDA PowerPoints. So there's huge documentation around that they were making these statements that this is totally okay to do. And well, of course, if you have unlimited government budget, maybe that's okay to do, but scientifically not. And if you're concerned with safety, absolutely not. And so that's what they were doing. They were just soliciting proposals, engaging pharma and academia in building up huge manufacturing base and being able to quickly brew these concoctions without any regard to safety, because they knew they're poison and they knew they're making poison, and they didn't care. They just wanted to scale it, make it huge, and be ready to go in a moment, which they
Did they
did.
know? Did they know at the time? And they know this was poison, but did they know then that they would have the protection, the umbrella protection of emergency use authorization? Therefore, they don't even have to worry about trials.
Absolutely.
They were aware from the beginning that they could create this poison.
Exactly. So there's another set of documentation which was called legal preparedness by the FDA. So the FDA legal counsel themselves have made numerous presentations. I have a gigantic file of them going back, same PowerPoint they were presenting every year to this consortium of companies. And they're just evolving it a bit, but it goes back to about 2012. In the most recent versions, they have slides that say, this is the law, explaining this whole framework of countermeasures to the consortium participants, because pharmas are like, well, I don't want to do this unless I have a full protection. So this is FDA going to pharma and telling them, don't worry. There's a whole new section of FDA Food and Drugs and Cosmetics Act, which we put in. It's called Section 564, which deals with medical countermeasures. And in fact, in the PowerPoint slide, they said, if we didn't have this section, we would have violated Food and Drugs and Cosmetics Act by doing this.
So they just added that section in to give them this additional protection.
Just to say, this section specifically says, if HHS declares pandemic emergency, then Food and Drugs and Cosmetics Act does not apply.
Does not apply.
Literally what it says.
So they were really pushing them in a big, big way. I mean, it was like the government really pushing them. Like, hey, we're going to.
Yeah.
And by the way, they even thought through like the questions you might ask from a legal perspective. Like, we'll provide the framework. Like, I know you might come back and be worried about this. Don't worry, we've got you covered.
Yes, absolutely. And I know how pharma companies executives think. So every executive always has a crew of lawyers around them because they need to have a legal protection from knowing something bad. Okay, from even knowing something bad. And of course, the pharma companies are always, you want me to do this? Well, what's my protection? And that's the dialogue that went for about a decade to convince pharmas that it's going to be all okay.
So these discussions, Bill Gates, Albert Bourla, et cetera, is that all part of this? So those early discussions, even back in 2017, is that part of this Netherlands case?
I have, in my testimony, I do go back to the 2017. I have the AstraZeneca tape and evidence and on the law that I've discussed, the removal of all the pharmaceutical regulations, because again, as I said, through the mutual recognition agreement, it's highly relevant for the European Union. And the government officials should have known, and of course they did know. And so that's part of the evidence package, and that's why my testimony essentially boils down to the statement. It's 60 pages long and 200 megabytes of attachments, but it boils down to single very simple statement that these injections are indistinguishable from biochemical weapons because they're poisons. They're poisons. Technically poisons, scientifically poisons, medically poisons, legally and forensically, in any way you look at it, it's a poison.
So there's no gray area. Like these are like a biological weapon.
Yeah, they are biological weapons. And in fact, we had the sixth witness, Francis Boyle, Professor Francis Boyle, who was law professor, who has written biological weapons convention law and related laws. And he was willing to testify that these products are bioweapons and that they fit the definition of the bioweapons under the convention. And 3 weeks after he agreed to testify, he suddenly died.
Wow.
So this was about a year ago.
Of course. So where does this case go from here? I know we're waiting for this appeal now. Your testimony entered in, but where do things stand right now in the Netherlands with this case?
So the appeal is for the second case with the three plaintiffs. And that was just to ask for us as witnesses, expert witnesses, to be heard in court under oath, which was denied by the lower court. And so we went to the higher court. We expected to be denied, but as I said, this is fine. We wanted to bring attention to the case, and so that's why it was open. Peter Stassen was able to negotiate, that the court would allow all the attendance that came in and the press event afterwards, and to get attention to this case, because we want to send a message to the Dutch government and legal system, which is very, I would say corrupt, just like everywhere in the world, and beholden to the government. But we want to send a message that you can't just quietly squash it. Now we have a hearing date on October 22nd, and that's very important, and we will be making a lot of announcements. We'll be inviting press. Anybody is welcome to come. It's a again, public meeting, open to the public, and we will have a press conference after.
Well, Sasha, thank you so much for your incredible work on this. Where can people learn more about, your work and where this case goes from here?
So my Substack, I publish updates on it. And I publish several articles on it. You can find information on my Substack. There is a foundation, it's called Redacted, foundation in the Netherlands that's funding this case. And they have a YouTube channel. It's also available on my Substack. I'll send you the link to that channel for the show. And that's in English. So that YouTube channel has a lot of material in English. And people are, absolutely welcome to help support this case. As I said, our budget is tiny. All of the experts are working for free. I traveled to Netherlands for my own expense. Everyone came on their own expense. And so we're just asking, please follow this case. Please support this case. It's absolutely real. Bill Gates is a defendant, absolutely real, and Albert Bourla. And so help us bring some sort of justice. I mean, I'm not hoping for 100% justice, but something. We need to get it somewhere to the public attention.
Right. We need these cases more than ever because that's where we get the truth. In the court of law, we actually can see the discovery. We can see the documents. We can get them on the record. And certainly not happening in the United States, given their protection. So thank you for your incredible work on this. Thank you for your testimony on this. And we will continue to follow it. Sasha, great to see you. Thank you so much.
Thank you, Clayton.